Welcome back, everyone, to the Deep Dive.
Glad to be here.
This is where we sift through complex source material, so you don't have to, bringing you the core insights.
And today, we're tackling something really foundational, I think. It's this amazing connection between the principles of visual art, what painters and sculptors have used for ages.
Right, to get that feeling of life and harmony.
Exactly. And how those very same ideas apply directly to, well, dentistry. Specifically, making dentures and other restorations look genuinely natural, alive, beautiful.
So our goal today is to sort of decode the science behind dental aesthetics. We're talking composition, balance, proportion, color, all those elements.
Yeah, moving past just guesswork, aiming for something predictable, dynamic harmony, not just static teeth. We're leaning heavily on Richard Lombardi's classic work from the 70s here. It really shifted perspectives.
And he kicks off with a pretty deep idea, doesn't he? About what aesthetics even is.
He does. He says it's not just about rods and cones in your eyes firing. It's fundamentally psychological. It's the interpretation of those signals by the brain.
So beauty is an emotional response, a feeling triggered by visual relationship.
Precisely. It's your brain processing how things relate to each other visually. And once you grasp that, you realize that the artistic principles, balance, proportion, they weren't just arbitrary rules.
They tapped into consistent human psychological responses.
Right. Which, gives us a kind of scientific basis for our aesthetic choices in dentistry. It takes some of the mystique or reliance on pure talent out of it.
And goodness knows, a solid framework is needed. The scale of prosthetic need, historically, is just immense.
Oh, absolutely. The sources mention figures like half of U.S. citizens over 55 being edentulous at one point, and even 90% of military inductees needing dentures in the past. It's huge.
So a simplified, principled approach is really essential for practitioners.
And Lombardi really boiled down the common errors into two main types. He called them the two sins of denture aesthetics.
Okay, what are they?
First is the sin against the principles of visual perception, basically breaking the rules of good composition, balance, stuff like that.
Makes sense, like bad art.
Kind of, yeah. The second is the sin against the principles of reality. This is where you might apply the art principles, but you push them so far that the result looks, well, fake. Impossible for a real human.
Like teeth set way too high or an alignment that just couldn't physically happen?
Exactly. It has to look like it belongs in a living person, not just pretty on its own.
Got it. So let's start where all visual art starts, composition, how things are arranged.
Right, and composition is all about relationships between parts. But how do we even see those parts? The eye only perceives through differentiation. It needs contrast.
Contrast in what?
Color, line, texture. If everything is the same, it just blends together, becomes invisible almost. So composition is really about managing these contrasts.
And the absolute #1 goal of composition, unity, making it feel like a whole.
Yes, unity. Or oneness. Ordering the parts so they create a total effect, something greater than just the individual pieces, like notes versus a melody. You need the notes, but it's the melody you perceive.
But there's a key difference for us in dentistry, isn't there? Static versus dynamic unity.
Crucial difference. Static unity. Well, it sounds like what it is. It's fixed, repetitive, geometric, I think snowflakes, crystals, perfect circles. It feels passive, inert.
Lifeless.
Pretty much. And it often comes from arranging things on a very regular, unchanging curve, like a circle.
Which brings us to what Lombardi called the greatest sin.
The silver dollar denture. Placing that static, dead-looking denture, often set on that perfect, unchanging circle, into a living, breathing, moving human face. It's a fundamental clash.
Because faces aren't static.
No. Dynamic unity is what we see in living things. Plants growing, animals moving. It's active, it has flow, maybe like a crescendo in music. It follows principles like the logarithmic spiral, but it's always changing, always interesting.
Okay, so we need the teeth to look like they belong together. That's unity. But we also need variety to make them look alive, dynamic. How do we balance that?
Well, unity comes from cohesive forces. Things like repeating shapes or colors, setting up clear patterns, following a principle, using borders. These things tie elements together.
But too much cohesion gives us static unity, right? Like a picket fence.
Exactly. So we need segregating forces too. Variety, we need elements that are bound together, sure, but in an interesting way. That's dynamic unity.
And the artistic ideal for this dynamic unity is Hogarth's line of beauty. I know people often just think S-curve.
Yeah, that's a common misunderstanding. It's not just an S-curve. It's actually a line drawn around a cone.
Around a cone. How does that work?
The genius of it is that the line is constantly changing. No two points on it are identical in their curvature that gives you maximum variety, but it always follows the underlying principle of the cone that gives you absolute unity.
Absolute unity with absolute variety sounds perfect. But how do we actually use a 3D line around a cone when we're setting 2D teeth?
It's more about the concept of continuously changing curvature. Instead of setting the teeth on a rigid circular arc, we use segments of curves with constantly changing radii. Think about the subtle shaping on a central incisors labial surface.
Right. It's convex, but not perfectly round. It has flatter areas, different light reflections.
Exactly. We're mimicking that changing radius principle as we move from tooth to tooth, especially across the front. The goal is an active flowing contour, not a flat, static arc.
Okay, that makes sense. But if we introduce all this variety, don't we risk chaos? Things just look messy.
That's where the next principle comes in, dominance. For unity to hold, one element, one shape, color, or line has to be clearly in charge. Everything else needs to be subservient to it.
If everything screams for attention, nothing gets heard.
Pretty much. The composition falls apart. And here, the sin against reality helps us. What logically must dominate in the dental arch?
It has to be the central incisor, right, given its position and size?
Correct. The mouth itself dominates the face usually, through its activity and focus. So the central incisor needs to be prominent enough to visually anchor the whole composition. If it's weak or lost, you've sinned against reality.
So how do we make the central incisor dominant using our dental tools?
It's fundamentally about making the mouth, and specifically the centrals, more visible, more impactful.
Okay.
We can use larger tooth molds, we can use lighter shades, higher value, because lighter things naturally draw the eye more.
Principle of illumination again.
Yes. We can place the teeth slightly more anteriorly, we can increase how much tooth shows vertically, the gingivo-incisal length. All these things boost visual presence.
But this needs careful calibration to the actual patient, doesn't it? You wouldn't give a very quiet person huge, bright front teeth.
Absolutely not. That would be a sin against reality, again, overwhelming the face. You tailor it. Strong personality, strong features. You might need more dominance from the teeth to achieve balance.
Soft personality, average features. You dial it back.
Exactly. You're matching the visual power of the denture to the visual power of the person wearing it. It's a balancing act.
Okay, so we have our dominant central. Now we need to manage the relationships between it and the other teeth. That brings us to proportion.
Yes, proportion, the relationship of width to length. And it's surprisingly counterintuitive sometimes.
Also.
Well, take two teeth, same width, but make one longer than the other. The longer one will actually appear narrower. It's the proportion change fooling the eye.
Interesting. And proportion gives us that crucial unity with variety factor.
It does. It lets us have teeth of different sizes that still feel related, still feel harmonious.
Now, when artists talk proportion, the golden mean always comes up, that 1.618 ratio, Parthenon, sunflowers, all that.
It's everywhere, and it's definitely pleasing. And this is a really important point from Lombardi, that specific 1.618 ratio. It's actually too strong for dental use.
Too strong. How can the perfect ratio be too strong for teeth?
Because living structures, like teeth and an arch, seem to need a softer, a more subtle visual progression than that pure mathematical ideal allows. Using 1.618 strictly makes the size drop off from central to lateral and lateral to canine too abrupt.
Ah, the lateral would look tiny, almost disconnected.
Yeah, it can look too small, too wet. The whole thing can feel a bit too calculated, too artificial, not organic.
Okay, so we ditch the specific 1.618 number, but we get the core idea behind it, which is
the repeated ratio. The principle is what matters. The ratio you establish between the width of the central and the lateral. You should aim to repeat that same ratio between the lateral and the visible part of the cuspid, and maybe even further back.
So different sizes, yes, that's variety, but the relationship between the sizes stays consistent. That's unity.
Exactly. You're organizing the different sizes according to a consistent principle. That creates order and harmony without rigid uniformity. It guides how wide we make each tooth appear from the front, and even how large we make any spaces between them.
And thinking about these relationships brings us to a tooth that apparently causes a lot of trouble, the first bicuspid. Lombardi calls it a sinner against both perception and reality.
It gets singled out quite a bit, yeah.
Why? What's so tricky about the first premolar?
Well, aesthetically, it really has to function like an anterior tooth. It's the visual bridge, the transition from the front six, which everyone sees, to the back teeth. It's absolutely key for maintaining that repeated ratio and creating a smooth visual flow.
And the sin happens when it breaks that flow.
Often, yes. Common mistakes are using a bicuspid mold that's too short gingivo-incisally or placing it too far out buccally. Either one just shatters the illusion of a natural arch form turning backwards.
Right, because that smooth turn relies on creating the illusion of depth.
Exactly. And that relies on the principle of gradation, like things appearing smaller as they get farther away. We need that effect to make the arch look like it curves back naturally, not like a flat wall of teeth.
So if the bicuspid is too short or sticks out too far, it breaks that gradual diminution.
Instantly. Kills the depth illusion. We also use light to help with gradation. Remember the principle of elimination. Lighter looks closer. So as teeth go back, we need them to look slightly darker, slightly less distinct.
And the anatomy that helps achieve this naturally is the buccal corridor.
Precisely. That space between the cheek and the teeth. As you look further back into the mouth, that dark space increases. Less light hits the posterior teeth,
Making them naturally appear slightly darker and less detailed.
which enhances the illusion of distance and depth. It makes the arch look three-dimensional. If you eliminate the buccal corridor or make those back teeth too bright, the whole smile flattens out visually. Looks fake.
Okay, let's shift gears to balance. We need stability in the composition.
Yes, balance or equilibrium. But importantly, it doesn't have to mean symmetry. Symmetry is formal balance, often static.
Like the snowflake again.
Right. What we often want in a living composition is informal balance, asymmetrical balance. Think of a seesaw. A small kid far out can balance a bigger kid closer in. The weights are equalized, but the arrangement isn't symmetrical.
Gives you more flexibility in design.
Much more, especially in the mouth. And this idea of balancing visual weights connects to another fascinating concept: induced forces.
Induced forces. What's that?
It's the psychological tension you feel when you look at something unstable. Imagine a picture of a disc just teetering on the corner of a square.
Yeah, makes you uneasy. You want to nudge it to the center.
Exactly. Your mind perceives a force pulling it towards a more stable position, usually the center. It's not conscious thought, it's part of the visual processing.
So how does that apply to teeth? We need a stable center point.
We need to consider the structural map of the face. The center, where the main visual axes cross, is the most stable point. Clinically, this points directly to the midline.
The midline location has to feel stable.
It must. It needs to be placed where it doesn't look like it's being pushed or pulled left or right by those induced forces. If it looks unstable, the whole composition feels temporary, restless, tense. A balanced midline feels calm, permanent, planned.
Now hang on. Dentists spend ages with rulers and reference lines trying to pinpoint the exact facial midline or related to the pupils. Lombardi seems to suggest we don't need to.
He argues quite strongly that the eye is the ultimate judge. If you just look at the tray-in, take a long contemplative look, any instability will make itself known. You'll feel that tension if the visual weights aren't balanced across the midline.
So measurements are a starting point, maybe, but the final call is perceptual.
That's the argument. Does it look stable? If yes, it is stable, regardless of what the ruler says. If no, it needs adjusting until that feeling of tension disappears.
That's quite a different approach. Trust your eyes. But what about managing actual things that have visual weight, like a gold filling?
Ah, yes, the classic problem. Teeth have weight, spaces have weight, restorations have weight. Adding something high contrast and high value like gold on one side can completely throw off the balance.
So how do we fix it without making it worse? What are the options for balancing that visual weight? Let's skip the bad one first.
The bad one is putting another identical gold filling on the other side. Static symmetry. Lombardi called it a set of headlights. Avoid that.
Right. So the dynamic solutions. Using informal balance.
We need a counterweight on the opposite side. One option: create a small, carefully shaped space, a diastema between the lateral and cuspid over there.
Okay, the space itself has visual weight.
Or use a slightly larger cuspid on the opposite side. Or show a bit more of the opposite cuspid by bringing it slightly forward, labially.
Increasing its apparent size.
Or, and this is quite elegant, use a slightly lighter shade cuspid on the opposite side.
Using the principle of illumination again, lighter looks bigger, heavier visually. So a lighter tooth balances the dense gold.
Precisely. It increases the visual weight without actually changing the size, but there's a strict warning about where you put gold.
Placement matters.
Hugely. It should really be kept to the distal of the central, or maybe the mesial of the lateral, closer to the midline, the visual fulcrum, but never on the mesial surfaces of the two central incisors.
Why is putting gold there so bad? Or even a gap between the centrals?
Because it visually splits the composition right down the most important line of unity. The connection between the two centrals must be the strongest visual relationship. Breaking that with gold or a large gap destroys the foundation.
Makes sense. And it's not just about weight, but also balance of direction.
Yes. If a tooth is pointing strangely, it creates visual tension too. Think about a crossbite case where maybe a cuspid is flared way out buccally.
It looks like it's trying to escape.
Right. Even if the size and shade are balanced, that directional imbalance disrupts the whole feeling of equilibrium.
Okay, let's talk about line, another key element.
Line is everywhere. In the tooth shape itself, the mold. In how the teeth relate to each other, those interdental lines, and in the overall flow of the incisal edges or the occlusal plane.
And line relationships create psychological feelings, right? Harmony or tension.
Definitely. The two extremes are perpendicular and parallel lines. Perpendicular lines create the strongest contrast, the most tension. Think of a cross, it's visually arresting. Okay. Parallel lines create the most harmony, the least contrast. Like an equal sign, it feels calm, resolved.
So clinically, between adjacent teeth, we're aiming for.
We're striving for parallelism. We want the outlines of adjacent teeth to flow harmoniously together. A common problem area is the distal outline of the lateral incisor.
How so?
It often angles inwards too sharply towards the midline, creates a sort of perpendicular clash with the lines around it. You might need to reshape it slightly or maybe position the neck of the lateral a bit more labially to soften that line, make it more parallel.
And the cuspid's line relates to the smile line, the lower lip.
Critically, the labial outline of the cuspid really defines the corner of the smile, and how you angle that cuspid influences the personality.
Explain that.
If you tip the incisal edge of the cuspid slightly inwards, lingually, its outline becomes more parallel to the curve of the lower lip during a smile. That's a softer, more harmonious relationship.
Feminine, maybe.
Could be perceived that way. Now, tip it slightly outwards, labially. The line becomes more perpendicular to the lip line. That's a stronger, more vigorous, maybe more masculine look. Tiny adjustments, big perceptual difference.
Okay, now we have to address the big one. Selecting the tooth mold based on the patient's face shape. Square face gets square teeth. Ovoid face gets ovoid teeth.
Ah, yes, the classic face shape theory. Lombardi really takes issue with this traditional approach.
Why? What's wrong with it?
Well, first, practicality. There are infinite face shapes, but only a limited number of tooth molds. And second, patients can change their perceived face shape easily with hairstyles, makeup, beards.
Things a square face look ovoid, or vice versa.
Exactly. But the bigger challenge comes from two core perception principles that undermine the whole idea.
Okay, principle number one.
Primacy of the whole. Once you arrange the teeth together into an arch, the individual tooth shape becomes much less important than the overall shape and dimension of the new whole that you've created, the smile unit. You see the smile, not isolated teeth compared to a face outline.
And the second principle.
The presence of a border. The lips act like a picture frame. They confine your attention to what's inside the teeth. Lombardi argues it's basically impossible for someone to simultaneously focus on the overall face shape and the individual tooth shapes within that frame.
The frame dominates attention.
It directs it inwards. So trying to match tooth shape to face shape becomes kind of pointless perceptually.
So if we're not matching face shapes, how do we select a mold?
The focus shifts. Pick a mold where the central incisor has inherent dominance, where the basic proportions look pleasing, and this is key, where the mold is easy to modify.
Because we'll likely need to customize it.
Almost always. There's a rough guide, the 16.1 head-to-tooth ratio for average size, but really the skill is in learning to take a few basic modifiable molds and adapt them to create the specific composition you need for that patient's mouth and personality.
And when we're composing that smile, we can't just look at the teeth. We have to consider the negative space too.
Absolutely critical. The dark space behind and between the teeth when someone smiles is just as important visually as the teeth themselves. Painters know this sometimes. You create the illusion of a tooth just by painting the dark shapes around it.
And the shape of that negative space contributes to vitality.
Massively. How the white incisal edges contrast against that dark background, the shape of the interdental spaces. That interplay creates dynamism and realism.
To help guide the modification of those anterior teeth, there's a simple guide mentioned, the 1, 2, 3 guide.
Yeah, it's a handy little mnemonic for customizing the front teeth. One refers to the central incisor. Modifying it primarily expresses age. Think wear patterns, slight rotations, flattened edges.
Okay.
2, 2 is the lateral incisor. It tends to express sex characteristics. Softer curves, more rounded edges might read as more feminine. Sharper angles might read as more masculine. It's often the most delicate tooth.
Then 3.
3 is the cuspid. It expresses vigor or personality. How prominent is it? How sharp is the tip? How convex is the surface? Its character speaks volumes about strength and vitality.
So central for age, lateral for sex, cuspid for vigor. That's useful. And there's a quick guide for posteriors, too.
Just a functional one. First bicuspid is mainly for aesthetics, that transition point. First molar is the main workhorse for mastication. Second molar is primarily for occlusal balance.
All this modification and planning reinforces the need for
Pre-planned aesthetics. Lombardi calls it the most important step and the one most often skipped.
meaning.
Meaning the dentist, the only one who actually sees the patient as a whole, person, their age, sex, personality, how they smile, the space available, must make the aesthetic decisions before the case goes to the lab.
The dentist has to allocate the tooth space, choose the mold, decide on the modifications.
Yes. The lab technician is a crucial partner, an ally in fabrication, but they cannot make aesthetic decisions because they haven't seen the patient. They need detailed instructions, sketches, maybe photos.
Otherwise, you risk getting back a generic, one-size-fits-all denture look.
Almost inevitably. Aesthetics has to be designed based on the individual right from the start.
Okay, last major section. Color. Always seems daunting.
It can be, but again, visual perception principles really help simplify it for dentistry. Color has 3 components: hue, intensity, and value.
Define those quickly.
Hue is the basic color name red, yellow, blue. Intensity, or chroma, is how saturated that color is, pale yellow versus bright yellow. And value is the lightness or darkness its position on a scale from pure black to pure white.
And in dentistry, which of these 3 is the absolute king?
Value. Hands down. Lombardi is emphatic about this. The success or failure of shade matching almost always hinges on getting the value right.
Why are hue and intensity less critical?
Because in natural teeth, the actual hue, like yellowness and the intensity of that hue, are usually quite low, quite subtle. The main thing your eye picks up is how light or dark the tooth is overall. If the value is wrong, too bright or too gray, fiddling with the hue won't save it.
That simplifies things a lot, especially since most skin tones fall in the middle range of the value scale.
Right. Which suggests we probably only need to seriously choose between maybe 3 main value levels for teeth: a light, a medium, and a darker one. The main challenge isn't having hundreds of options, it's understanding what affects the perceived value.
Like surface texture and glaze.
Exactly. A smooth, glazed tooth reflects more light, looks lighter, higher value. A rougher, unglazed, or highly textured tooth absorbs more light, looks darker, lower value. Same underlying shade, different perception.
And the background matters too.
Definitely. A dark background like the inside of the mouth or dark lips makes any color placed against it seem lighter by contrast.
And we keep coming back to the principle of elimination. Lighter looks bigger and closer.
Which means value is a tool for positioning, not just matching. Need a tooth to seem more prominent, further forward? Use a slightly lighter value. Need it to recede? Use a slightly darker value. It's incredibly powerful.
Now, let's get into that fascinating lipstick effect, the interaction between makeup and tooth color.
Yeah, this is really interesting, especially for patients who wear lipstick. When you put a strong color, like bright red lipstick, right next to a relatively neutral color, like a tooth. The neutral color, the tooth, tends to visually call forth the complementary color of the strong color. The complement of red is green.
So red lipstick can make teeth look greenish.
It can induce a subtle greenish tinge, yeah, which is usually undesirable.
So how do we counteract that? We can't tell patients not to wear lipstick.
We build the neutralizer into the tooth shade itself. The complement of green is red or pink. So the selected tooth shade needs to have enough underlying red or pink tones to cancel out that induced green.
Ah, so that's why many popular commercial shades historically had a bit more pink in them.
Very likely. Manufacturers, or maybe dentists and patients intuitively, figured out that pinkish base was needed to keep teeth looking natural next to common lipstick colors.
All these variables, personality, features, skin, light, make straight shade matching tricky. Lombardi proposed a formula to help guide value selection.
He did. It's a way to systematize the decision, make it less purely subjective. It assigns numerical weights to different factors to determine the overall lightness needed. 3 means the factor strongly indicates a lighter tooth is needed. 1 means it indicates a darker tooth.
Okay, so the formula is personality plus features plus skin plus total tooth area plus light. 5, required shade value score. Let's break down those variables. Why does a strong personality get a 3?
Because a strong personality needs teeth with enough visual punch to match it, to not look washed out, so it requires lighter, higher value teeth. Soft personality, 1, needs softer, less demanding teeth.
Makes sense. Features. Strong, large, dark features get 3.
Same logic. Strong features need brighter teeth to balance the composition. Weak features, 1, would be overwhelmed by very bright teeth.
Okay, skin tone. Light skin gets 3, dark skin gets 1. Why is dark skin a 1, indicating darker teeth?
Because the dark skin already provides a dark background contrast. Remember, dark background makes teeth look lighter. So with dark skin, the tooth itself doesn't need to be as light to appear bright enough. Light skin provides less contrast, so the tooth needs to be inherently lighter.
Clever. Total tooth area exposure.
Yeah.
Small exposure gets 3.
Yeah, if only a small amount of tooth shows when they smile, that small area needs maximum impact to be noticed. So, lighter 3. If they have a huge broad smile showing lots of tooth area 1, the impact is spread out, so the individual teeth don't need to be quite as bright.
And finally, light. Dark, heavy lips get 3.
Right. If the lips or the oral environment restrict light getting to the teeth themselves need to be inherently lighter to compensate for that dim environment. Bright, open smile, lots of light. 1, the teeth don't need to be as light intrinsically.
Let's try 2 quick examples. Mrs. A, strong personality, 3, strong features, 3, light skin, 3, small tooth display, 3, heavy lips, low light.
Okay, that's 3 plus 3 plus 3 plus 3 plus 3 divided by 5. That's 15 divided by 5 equals 3.0. She needs the highest value, the lightest shade available.
Now, Mrs. B, soft personality, 1, average features, let's say 2, light skin, 3, big smile, large display, 1, good light, 1.
So 1 plus 2 plus 3 plus 1 plus 1 divided by 5, that's 8 divided by 5 equals 1.6. Much lower score. She needs a shade value closer to the medium, maybe even slightly darker end of the typical range.
Wow. So even though Mrs. B has light skin, the other factors pull her overall value need down significantly.
Exactly. It shows the power of looking at the whole perceptual picture, not just one factor like skin color. This system forces a comprehensive analysis.
We have certainly covered a huge amount of ground, from the psychology of seeing beauty through composition, proportion, balance, line, and finally value and color.
It really feels like once you understand these core visual perception principles, a lot of the guesswork and confusion around dental aesthetics starts to fade away. You don't need to be a born artist.
You have a framework, a set of predictable tools.
Right. And the ultimate aim, as Lombardi put it, isn't just to make teeth. It's to restore that patient's quality as a living human being, to lift them out of being just a sort of geometric problem and give them back their vitality, their dignity.
And that final check, just taking that long contemplative look at the try-in, is so crucial. Trusting your eye to feel the harmony or lack thereof.
If something feels wrong, tense, unbalanced, it probably is.
Yeah.
Your perceptual system is telling you something needs adjustment until that feeling of ease and rightness is there.
Replacing the static with the dynamic, the random with the planned.
That's the goal. Harmony.
Okay, so we've learned today that achieving dynamic unity often involves making artistic adjustments, dominance, balance, proportion to create harmony with the patient's overall being. But that leads to our final provocative question for you to think about. Where do we draw the line? How much do we prioritize achieving that perfect artistic harmony based on these principles versus respecting and perhaps even preserving some of the patient's original, maybe slightly imperfect, but deeply characteristic and personally familiar dental features? When does perfect become too perfect and maybe even alienating? Something to ponder. Thank you for joining us for this deep dive.